Botox, you usually think of cosmetic purposes for it, right? Well, sure, it helps wrinkles, but it is also being used to treat issues that are not skin deep, issues like depression. And joining us this morning to talk more about it is Dr. Matthew Knight from the Central Florida Society of Dermatology. Great to see you, Doc.
Thanks
How are you?
Happy Friday, as always.
Happy Friday. Okay, so this is fascinating. So I want to talk first about sort of how Botox came about, because I think it's fascinating, just sort of the history of it, right?
It is. So it was almost by mistake. A lot of things in medicine, like Rogaine and other things, are found by mistake. This was a husband and wife team, an ophthalmologist, dermatologist, that were injecting it for eye problems, and they found that the wrinkles went away. Now, this was 20 years ago.
Yeah.
But that's kind of how this came about. There were dermatologists that were injecting Botox for cosmetic reasons to make us look better and more well-rested, and they found out that their patients said they felt better too. So there was a small clinical trial that was done that had almost unbelievable results, where like 9 out of 10 people said their clinical depression went away. This is real depression, people on antidepressants.
Right, not just I feel sad, but like you're actually clinically diagnosed.
Clinical problems of depression, which affects like 9 million American women. It's a huge problem. And that was backed up by more recent studies that were in Europe. There's one in Switzerland that looked at bigger populations, and lo and behold, there actually was a correlation. So Allergan, the $3 billion company that makes Botox, is now looking at this phenomenon in phase 3 trials to see, does it actually affect people? Can it make us look better, but also feel better for people with actual clinical depression or anxiety or even bipolar disorder?
And Doc, if you are clinically depressed, would you inject it the same way? Would you still like, oh, I'm going to get rid of the wrinkles, and, right? Or would it be injected in some other way?
That's a great question and really interesting. It was the same injection pattern.
Okay.
So the idea behind this is that our emotions and our feelings are not a one-way street. And philosophers have always talked about this for hundreds of years, but the way we feel affects the way we look. But what if the way we look, if we can change that, affects the way we feel? And there is some clinical science to back this up. There was a really cool study in kids that were watching cartoons, and they were made to smile. And the kids that smiled through the cartoons, they put a pencil in their mouth or something. They viewed the cartoon as more funny than the kids that weren't smiling the whole way through.
Wow.
Another study in adults and men who were made to frown and look at pictures that were disturbing pictures, and they rated the pictures as worse than the men who weren't frowning. So there might be more than just a one-way avenue here. So we can inject Botox the same way we do it in the clinic all day, and people feel better on the inside. It's really remarkable.
So what you're saying is potentially it could just be sort of the placebo effect, right? It might really not have an effect at all, but you think it does. So
that's the downside of this, right? And Allergan did do phase 2 trials, and their results weren't quite what they were looking for, believe it or not. And there's a huge placebo effect here. If I injected you with something and said it's going to make you feel better, on the inside it might make you feel better on the inside. And that's where phase 3 trials come in. These are big trials across state lines, looking at hundreds or thousands of people with placebos and the real deal, seeing if this actually has an effect. But I'll tell you what's really neat here is Botox and Dysport and other neuromodulators are the world's #1 cosmetic procedure. So what if this was another tool in the belt for doctors to treat what can be crippling diseases like depression and anxiety? And even if it doesn't work that well, hey, if you get Botox at the bedside and you want to look better and you actually feel a little bit better on the inside too, that's an added bonus.
Why not? Absolutely. It's truly fascinating.
Really cool
Doc,
story.
thank you so much. Well, okay, real quick before I let you go. If, in fact, they find that it treats depression, could it be eventually covered by insurance?
Well, maybe, right? So
yeah, because that's the other thing is people say it's too expensive.
Can you imagine going to your psychiatrist for your Botox injections? That could be the next step.
It could happen.
Yeah.
Dr. Knight, how can our viewers find you?
KnightDermatology.com or right downtown, and everyone have a great weekend.
He's
Thanks.
Great. Thank you so much. Good to see you, Doc. All right, 7:44 right now, and we are going to check in with Jamie King, find out how things are looking outside. Jamie?
All right, good to see you, Amy. Dr. Knight, here we go. Roll the animation.